Welcome back to West Texas View.
One of the things that Dr. Melinda Morris is very good at is teaching. And she said that a good physician is always a good teacher because that's part of her responsibility is to teach her patients. And so if I didn't say that right, correct me. But tell us what you teach your patients about prevention.
Well, you know, an obstetrician gynecologist is actually a primary care doctor for women. And being a primary care physician, you're involved in health maintenance and preventative medicine and teaching your patient how to be healthy. And, you know, with women, that's very important. Most women know that, you know, they're supposed to come in and get their annual pap smear every year, and then they know they're supposed to start getting mammograms. And there's actually been a change in some of the guidelines and recommendations from the American College of Obstetrics and Gynecology. This came out about a year ago. But some of the new recommendations is that they don't recommend a pap smear anymore until age 21.
Oh.
And I think, you know, there was an understanding that maybe when girls were 18 or, you know, I've even had mothers bring their daughters in at 14 or 15 thinking that they needed to start their annual exams. But, you know, if they're not having any problems or issues, they're not sexually active, then the new recommendations is until they're age 21, they don't need to start getting their annual pap smears. Some of the new recommendations that are coming out as well is that if you've had a history of normal pap smears and your pap smear has been normal for like 3 years in a row, then you can go every 2 years without, you know, for your annual exams. So
and the same way with mammograms, that's been lengthened.
That's kind of been changed. You know, it used to be, you know, you got a baseline mammogram age 35 to 40, and then age 40 you considered starting getting mammograms maybe every other year, and then age 50 start getting mammograms annually. You know, now if you had a strong family history of breast cancer, it was recommended that you start a little bit earlier. But now the recommendations is that you don't need to start mammograms until age 50 on a regular basis. You know, so some of those guidelines are changing a little bit. But, you know, when ladies do come in for their annual exams, you know, we talk about their health maintenance and their overall health. And I'll have to say that one of the biggest issues with our health today is the obesity epidemic. There's no doubt about that. And, you know, because so many women that I've seen have issues with their weight and questions about maintaining their weight, I became very interested in nutrition as well. Because the only way you're going to maintain your weight is through a healthy diet and with exercise. And, you know, a lot of women will come to me and say, you know, I have the same diet I've had all my life, and now I'm 20 pounds heavier. I don't understand that. And so one of the first things I explain to them is that as you get older, your metabolism starts to change. And you actually burn 100 less calories a day for every decade that you age beyond 20. So once you're in your 30s, you're burning 100 calories less a day. Once you're in your 40s, you're burning 200 calories less a day. Once you're in your 50s, there's 300 calories less a day. So unless you're modifying your diet to compensate for that change in your metabolism, or you're increasing your activity and your exercise level to compensate for that change in your metabolic rate, you're going to start gaining weight. And, you know, so many ladies in their mid-40s were, you know, 10, 15, 20 pounds overweight, and they couldn't understand it. And so that became kind of a regular routine part of the annual examination, was to explain that to them, talk about how important the diet is, you know, decreasing your caloric intake, increasing your exercise. You know, you need to be exercising at least 30 minutes, at least a minimum of 3 days a week, you know, just to maintain. And then if you want to lose weight on top of that, you're going to have to increase your exercise level and really modify your caloric intake.
And so many times the exercise, the busyness of a person slows down at the same time their metabolism is, but they're eating the same or more.
They're eating the same.
And so it all kind of comes crashing in. But also, we talk a lot about obesity, but even 10 pounds or 20 pounds overweight maybe doesn't make them in the obese range, but really has an effect on their health.
And that's why education is so important, because I don't think the public as a whole understands the impact of being overweight and being obese. It's not just a cosmetic issue. It's just not a matter.
Vanity doesn't. Really
it's just not a matter of, okay, I'm going to buy a little larger size in clothes. It has a direct impact on your health. And what's hard for me to see are the children that are already overweight.
I know.
Because with it starting at such an early age, do you know this is the first time in history where the younger generation has a shorter life expectancy than the older generation? And a lot of this has to do directly, with the lifestyle changes
from birth on, with what they're eating.
Yeah. And one of the things I educate patients about is their BMI, which is their body mass index. And the technical calculation for that is your weight in kilograms over your height in meters squared, which sounds very technical. But you can go on the internet and Google BMI or body mass index, and it'll give you a table, it'll give you a chart, it'll show for your height what is your ideal weight, and you can calculate your BMI. Now, normal would be 18 to 25. That would be the normal weight range. 25 to 29 is overweight, and 30 and beyond is obese. If you have a BMI of 40, you're considered morbidly obese. And if you have a BMI of 50, they now have a new category. A BMI of 50 is extreme morbidity, extreme obesity.
And how many people do you think knows what their BMI is?
I think a very small percentage knows. It's actually becoming kind of part of your annual exam now to calculate your BMI, so that the patient actually knows and understands what category that they're in, so you can start addressing the issues.
One of the interesting things is, of course, at my age and stage, I go to all the senior wellness seminars and fairs that they have, and that's one of the things that you get calculated at the wellness fair.
And what's so important is the obesity is going to have a direct impact on your health. I don't know that there's an understanding that fatty tissue produces hormones, not good hormones, and fatty tissue produces inflammatory chemicals. And that's why a lot of times, along with the obesity, they start noticing increase in pain, arthritis symptoms, that sort of thing, is because the fatty tissue is actually producing a lot of inflammatory
chemicals.
Off
poison.
Yeah.
We're going to take a break right now. We're going to be back in just a minute and continue this conversation. Thanks. Be right back.
Stay tuned. West Texas View will be right back.